Kementerian Kesihatan mengesahkan 3 kes novel coronavirus berlaku di negara ini melibatkan warga Cina.
Sakit merupakan seorang lelaki warga negara Malaysia berumur 41 tahun dari Selangor.
In the healthcare world, efficient record management is crucial. Traditionally, paper charts were the norm, but technology is rapidly changing the game. This video will explore the world of electronic health records (EHRS) and the other record management technologies that are transforming how healthcare providers store, access, and utilize patient information. We will delve into the benefits these systems offer, from improved care coordination to enhanced patient engagement. The healthcare system relies heavily on records management technology to ensure efficient and secure handling of patient information. This technology, often in the form of electronic health records (EHRS), acts as a digital hub for a patient's medical history, allergies, medications, and treatment plans. By replacing paper charts, EHRS offers numerous advantages. They improve accessibility for authorized healthcare providers, allowing for faster diagnosis and more informed treatment decisions. Additionally, they enhance communication and collaboration between different care settings, promoting continuity of care. These systems also enforce access control and audit trails, safeguarding sensitive medical information.
Here we have the examples of record management during COVID-19 in Malaysia, such as MySejahtera and MOH, Ministry of Health COVID-19 in data reporting. Actually, there are also the issues related to the record management during COVID-19, and some of the issues in MySejahtera is the data privacy and security concerns, like the personal information being exposed in the data breaches, and the transparency concerns were raised regarding the storage, usage, and sharing data with the other government agencies or third parties. Next, the technical and user interface issues, like when users have reported that it impacted the functionality of the apps, including the crashes and slow loading speeds. One, also, the apps might be not user-friendly and difficult for those with the less technology knowledge to navigate and utilize the effectively. Also, MOH, Ministry of Health and COVID-19 data reporting also faces some issues during the record management, such as the human resources limitation. The healthcare workers lack proper training in digital or record keeping that resulting them in making mistakes. Also, it leads to workload and stress because of the pressure from the managing record keeping tasks. And then the data overload, because they have to update in real time. It was very challenging for them, especially with the rapidly changing situation and involving case numbers that had made the issues for this record management.
Next is causes and effect of COVID. First is respiratory droplets and airborne transmission. When a person with a COVID sneeze, cough or cough or breathe, the droplets from the lungs are the main way in which the virus spread. People in the surrounding area may inhale these droplets and breathe them in, or they might receive them in their mouths, noses or clothes or eyes. Second is close contacts. The World Health Organization points out that the risk for spreading is much increased when one person is close to an infected person, within 1 meter, especially when the individual is inside, because respiratory droplets which carry the virus can travel this distance and possibly infect individuals around. Next is super spreading event. Super spreading events might happen in situations where the virus can easily spread among a large number of people, such as loaded indoor gathering. So for example, Sri Petaling Tabligh cluster that have positive cases and was discovered among 600 monitoring samples from the patient with influenza illness and serious breathing problem. Lastly is polluted surface. Respiratory droplets allowing the virus might fall on nearby surface, like door surface or tables. When an infected person sneezes or talks, the virus may potentially affect this surface. With reduced risk, frequent touch surface in homes, office and public place should be regularly cleaned and disinfected as a protection. This recommendation comes from the requirement of public health to lower the risk of transmission from contaminated surfaces. Practicing good hand hygiene is important. This includes washing hands with soap and water or using hand sanitizer that has at least 60% alcohol.
There are few solutions to prevent COVID-19 transmission in Malaysia. The first one is public health measure. The government has enforced various levels of movement control order (MCO) to limit the Malaysia citizen movement and to reduce the spread of the virus all over in Malaysia. The second solution is healthcare system enhancement. To lower the risk of COVID-19, Kementerian Kesihatan Malaysia has established treatment and quarantine center for patients who have a mild system to reduce the burden on the hospitals. The third solution is testing and surveillance. Kementerian Kesihatan Malaysia has introduced home isolation and monitoring for patients who have mild symptoms. The last one is a vaccination campaign. Malaysia government has rolled out extensive vaccination campaigns to ensure that a high percentage of Malaysian population is vaccinated. As for now, Malaysia is currently in the phase of living with COVID-19 and transitioning towards a normal life. And now, COVID-19 positive individuals will be no longer under the home surveillance order. Instead, they will be treated similarly to other respiratory infections. If you are infected with COVID-19, please stay at home, follow public health guidelines, minimize interaction with other people, and seek medical centers or hospital if the symptom of COVID-19 are worsened.
In conclusion, even though that COVID-19 is a global pandemic, this may be related to the genetics of the virus, features of those who are vulnerable, population behavior, and how the country has responded to the crisis. Besides, the country had to cope with the health crisis while maintaining, for business purposes, continuity and safeguarding vital records within other difficulties. This includes the needs for true disaster recovery plans and reliable electronic record management systems to make sure they are capable and handling a range of disruptions, including pandemics and natural disasters. These need to be tested and updated on a regular basis. So, to encourage efficient responses and recovery activities, it is necessary to keep a clear path of communication and clearly establish roles and responsibilities. Last but not least, this perspective will be important in reducing the impact of upcoming crises as Malaysia continues to recover and strengthen its resilience.
Okay, that's all from us. Thank you.